is to use the smaller dot laser, if you will, which makes 0.3 millimeter tiny little tunnels, if you will, or channels into the skin. I control the depth of those channels by using the fluence or the power of the laser, and then we put the stimulant, if you will, the hematopris, which is used for lashes. It makes lashes darker and longer and thicker. But the key is the darker part. If it stimulates the melanocytes to start getting more active, and we can deliver it down into the tissues, we can see color coming back. And that was done in these studies in Florida with a colleague of mine that was looking at it with a condition called vitiligo, where they're like Michael Jackson had theoretically had vitiligo, his skin was all white in certain patches. And that same thing can work here from behind the ear. So I'll have you applying it. And obviously these are tiny little holes, so they heal really quickly, but the channel is still kind of there, even though it's quasi-healed. We're going to apply it right away, and the benefit of this type of laser is that when it shoots the little dot, it creates a little zone of coagulation along the channel, so it's not if it was bleeding, you put it on there, it would just come back out. Right. So that's why we use this type of laser. And the little dots don't really, they are going to provide a remodeling benefit anyway. Okay. So it's not going to make the already pigmented areas any more pigmented. It's just going to kind of lift or stimulate the melanocytes, the cells that make the pigment, into doing that. These are all newer sort of concepts and technologies that we're excited about, because it's really helping in an area where we historically didn't have a lot of answers. Right. So, but it'll help with making the skin more even anyway, so that's a dual benefit, if you will.
And the evening of the tone would be great.
Yeah. Yeah.
We'll see what happens, but as always, I have realistic expectations.
Yeah, it'll work. It'll help, I'm sure. So turn your head just a little bit more for me to the side, and then we're going to put some covers on his eyes there. And so this is just for your protection. So did you hear all that discussion, Dr. Nadimi?
Bits and pieces.
Do you have the concept?
Making little channels and then putting the lattice on there so that it can...
Yeah, it's the hematopris. It would go with the non-branding, and then I'm going to blend the skin around through here that was really, he had an infection and got all inflamed, and we had to use secondary intention wound healing. Some of this is really good. You can see the texture of this pigment here, but these areas don't have much texture, so trying to stimulate the skin cells to really get a more, see this here is more like this, except it's injected. So that's what we're going to do, blending those edges. If you think of if you looked at how much square area was involved, I'm going to give you a little pinch here. You tell me are you feeling any of that?
I can feel a tiny bit of it, but not at all painful.
Okay. I just want to make sure it's nice and numb here. You felt a little sting there?
No, I didn't feel anything.
Okay, good. Just want to make sure this is all nice and numb here. Hopefully it's kind of filtered out. So that light probably isn't helping very much once you turn it away. And that probably that's better light for me. So I'm going to make sure I hit the margins first. Right where the normal skin meets the sort of hypopigmented skin, because that's where the new keratinocytes and the new epidermal growth will occur, and then the stimulation of the little melanocytes. You can see the skin tightening effect here also, stimulated with good skin cells. So a little bit smaller spacing. You can see those. because this isn't as good as skin, right? But it still creates the little pathways for it. I'm going to get this hair out of the way here. So I can also use a laser if it's not a perfect square or it doesn't match the perfect square like those did. I can do just step on it for a second and make a rectangle, right? So it's just a matter of getting used to the foot pressure on there and then adjust. So, like I said, I want to hit that little rectangular area here. I can just turn the beam so that it's going in that direction, right? And I'm going to go wherever there's a chance that I can get some new pigment. So right up, I'm not going to go all the way to the post-auricular sulcus because that's probably unnecessary, but yeah, I'll put a couple up in this area here because they're near his hairline. Good. So this zone was the zone of basically cellulitis, poor wound healing, secondary intention healing, and we were able to get it managed quickly and aggressively, so you didn't, get into any kind of big problems. But it did take a long time for that all to heal, and so the other part is probably I'll take a little alcohol white now because he doesn't need all the marker on here. And I want to get that cleaned off before I do the lattice, because lattice is a molecule, probably alcohol is going to break it down some. I don't want any of that on there. And get some of this off here. This will wash off too. This is a sterile ink that we're using for your marking, and it'll just wash off over some time. And then see this little area right at the crease here? You can make that dot even smaller and make the scar look a little better right at his junction of his lobule in the face. So because there's very little damage to the skin, it's really very small dots. Okay, you can erase the ear there. A little pinch here. You okay?
Oh, fine.
Okay, good.
If you're interested in more information on this topic or any of our other topics, please don't hesitate to write at drmaas.com. You can send videos, you can send photographs, or just written text with questions, and I'm happy to answer them. We're more than happy to have you visit our website or visit our Facebook page at facebook.com/Maas Clinic. This is Dr. Corey Maas on Looking Your Best.